All right, I'm going to be the last speaker before the posters, I understand, so I'm going to really watch the time. So I'm going to set my time. I appreciate being here. I'm a physician. I have a little bit of a different talk than the others. I've really enjoyed the talk so far. But I'm going to give you a very interesting, hopefully entertaining peek into my world. Let's go ahead and get started. All right, just to quickly let you know, I'm coming from the southeastern part of the United States. It reminds me of this city a little bit with the rivers and beauty. I believe that ultimate health and maximal lifespan requires at least two things. One, it requires metabolic harmony and nutrient abundance. Unfortunately, most of the work has been done on the RDA level, where the recommended daily allowances are just really so low that I don't think we can create any kind of longevity or any ultimate health benefit if we follow them. So my task today is to describe what is the purpose of our little pilot study that I'm going to present at the end. I think you're going to see something, I think this list a little bit challenging to the dogma. I think we're going to show you this little pilot study as the first study to identify cellular micronutrient needs. And we're going to restore these individual micronutrients with precision, both independently and simultaneously using therapeutic levels of vitamins. Each word in this statement is specifically chosen, and I hope it makes sense at the end why it's so important. This is an attempt at a little sarcastic humor, but I think there has been an epidemic in America. It's probably invading the entire world. That epidemic is not HIV or obesity. It's misinformation and poor conclusions. I'm going to show you a litany of studies that give us completely different messages. And I think I can have at least a partial answer to why we're having this. Here's an example. Just recently in the Journal of American Dietary Association, showing multivitamins have no effect on children as far as in their academic performance. Another study from Venezuela says there's no evidence to support B vitamins in cardiovascular risk reduction. From the prestigious clinic, the Cleveland Clinic, here's a doctor that says that the public's belief in the benefit of vitamins and minerals is not supported by the available data. I'm puzzled why the public likes vitamins. Well, despite this whole mess, in America we spend $4.7 billion on vitamins each year, which happens to be the gross domestic product of Somalia. So there is some patient-driven need, and I'm going to show you what the patients are asking for, despite these studies. I believe we have a perfect storm in America. I believe when we do critical thinking, which is the most important thing, I believe, is not telling people what to believe, but how to think. I think if you go through this tree, you're going to see there's really three main groups. One is our perception of the problem, our assumptions that we're making about the problem, how to solve them, and then looking at the evidence to decide if it all makes sense. As scientists, we tend to focus around evidence, but unfortunately, we have poor evidence. We have made improper assumptions, and I don't believe we even really have a grasp on the problem. So I think this is the perfect storm. I believe these are the four benchmarks that every study should have to meet for us to be able to form any conclusions of any merit clinically. Unfortunately, I've not read one clinical study that meets these four imperatives, not a single study. Our pilot study is the first study attempting to meet these four standards. I understand it's a bold statement, but I hope I can convince you that it's true. But the imperatives are individualization. You know, I'm an epidemiologist as well, and we've all felt that populations are patients. If you use that to apply to clinical studies, you're in a world of hurt, because there are no two individuals that have the same needs. If you treat people with the same product, they have different needs. You can't expect to form any conclusions. Second, the evidence is so weak because I don't believe the testing that we do is accurate. I'm going to quickly go through the testing that's out there. Nutrient cohorts. I don't think we can treat clinical disease using single nutrients. If we use a single nutrient and try to find an effect, we'll be sorely disappointed, and that's why I think the studies are what they are. And the fourth imperative is therapeutic dosing. If a study meets the top three, they usually fall down to the last, and they usually treat with something like the recommended daily allowance, and that's just not going to work. Let's go through these tests real quick, these four imperatives. Individualization. Individuals do matter. People now are demanding individual attention. They want to have their medications, their treatment programs, and their doctors treat them individually. And there's a vitamin explosion. I'm not sure in this country, but in America, there's vitamin shops on every corner. A typical vitamin shop may have over 50 different brands, maybe up to 100. Vitamin World, GNC, and Vitamin Shop are some of the most popular. In an attempt of companies to try to meet the need of the consumer who wants individualization, now the one-a-day vitamin company now has 18 different versions. They believe they can target people by coming up with a new colored box, apparently. If you look at women's active metabolism, that assumes that all women are alike in their need. Or if you need energy, anybody who needs energy has the same requirements. All this is a marketing ploy, because when you look at the formulations, they're almost identical. And besides, it's almost an insult to think there are two women that need the same thing. In fact, the same woman doesn't have the same need her entire life. So this is what we're up against. And when you test vitamins like this, you're going to get inconclusive results. Here's a study. We looked at just the top 50 brands. Along the bottom of the blue line is the vitamin content. In the gray line is the mineral content. And at the top, the green is the antioxidant range. You don't have to look very hard to say these look very similar, to say the least. And they are. The only thing different between vitamins today is the bottle color and the label. So when I said I want to create a vitamin that's unique, who respects individuality, I want it to be based on great science, and I want to produce it at a very economical cost. And I was told, well, that's impossible. It's certainly impractical, and it's too idealistic. And I said, well, it probably is going to be impossible, and it turned out it's close to being impossible. Impractical, not any longer. Idealistic? What's wrong with being idealistic? So in order to address this problem of individuality, we came up with an algorithm that requires at least 60 questions just to get a feel of what the person's environment is. I just took a snippet of the algorithm just to show you just an example. For example, right at the top you may see some blurry questions, but these are all the 60 determinants of health that we conduct. If you just look at smoking or alcohol use, these influence vitamin formulation quite dramatically, as they should. If somebody's a long-distance runner, had cancer, or any of the other effects, the 60, it affects the formula as it should be. We can't rely on just the determinants of health and history to make formulas. This is some unpublished data we're looking at. Some of our vitamins going out. We have about 186 custom vitamin patients. And when you're looking at gender as one of the determinants of health, you would assume that women have a different need than men. I mean, that's just almost without question. The truth of the matter is, it doesn't appear to be the case. This is an assumption. I think we've made an assumption that women's cells are somehow pink, and men's cells are somehow blue, and the men's cells are bigger than the female cells. That's how we're really treating this. The truth is, the cells are the same. They have the same needs. And when you look at formulations that go out, they're remarkably similar. We're going to look into this in the future quite dramatically, because I don't believe that women's